Medicare is under constant threat. Each year you hear yappity yap politicians, entitlement reform, balancing the budget. Medicare is almost always on the chopping block. Why? Because it's expensive. Of course it is, right? It accounts for about 15% of the federal budget. And some politicians, especially those who call themselves fiscal conservatives, argue that the program needs to be trimmed down, privatized, or made even more efficient. But here's where I stand. I believe it's worth more than 15%. In fact, I believe healthcare should be a basic human right, not something reserved for the wealthy or the lucky. Right now, working class Americans are out there breaking their backs just to stay afloat. They're not asking for handouts. We're not asking for handouts. We're just trying to survive. And for a lot of folks, healthcare isn't even in reach, no matter how many hours you work. That's just not acceptable. It's time the government actually lives up to its promise, the one written right in the Constitution, to promote the general welfare of its people. Not the general welfare of corporations, not the welfare of lobbyists, not the welfare of $1 million handouts to billionaires, but the general welfare of everyday Americans. Programs like Medicare don't drain our nation, they define it. They say, hey, we take care of our own, and that's something worth protecting and strengthening for generations to come. So let's dig a little deeper into why these politicians, particularly those who identify as fiscal conservatives, keep coming back to Medicare when they talk about budget cuts. They say they stand for the people. I don't know what people they're standing for. It's not any people I know. On the surface, their argument sounds reasonable. We're spending too much. Right? The national debt is out of control. We need to rein in government programs to balance the budget. And yes, Medicare is expensive. The federal government spends hundreds of billions of dollars to keep it going. All right, it's one of the biggest single line item on the budget, right alongside Social Security and national defense. But here's the thing: the push to cut or privatize Medicare isn't just about numbers on a spreadsheet. It's about ideology, and a terrible one at that. Fiscal conservatives often believe in limited government, which is fine, but the private sector can't handle healthcare. They've already shown it, right? From their perspective, programs like Medicare represent an overreach of federal power and create some dependency. They argue that private markets are more efficient and more innovative and more accountable. But we already know that this system failed seniors before. The private system failed seniors and those with disabilities before. We already know that. So when you hear phrases like premium support or market-based solutions or voucher systems, what are they really talking about transforming Medicare from a guaranteed benefit into some fixed dollar subsidy? The way seniors can shop for private insurance plans instead of receiving coverage directly from the government. And who benefits from a shift like that? Ask yourself. Well, it's not hard. All you got to do is follow the money. Private insurers, pharmaceutical companies, and large healthcare corporations. The billionaire corporations stand to gain even more billions from a more privatized Medicare model. And those same industries are some of the top contributors to political campaigns, especially on the right. So, how do you think retirees can afford to pay for this extra coverage? The answer is they can't. And going back to a more private system will just leave millions of hardworking Americans that are in their twilight years to suffer. So, yes, the rhetoric is about responsible spending and free markets, but behind the scenes, there's a powerful economic incentive at play. Influence, profits, campaign funding, lots of campaign funding. And while there are some good faith actors in every political camp, we have to ask ourselves, is what's the goal really? What's the goal here? Are they trying to dismantle it? Right? They're trying to give more $1 billion tax cuts to people because for the average American, especially someone living on Social Security, a cut to Medicare isn't just an abstract policy change. It's skip medications, missed doctor's appointments, delayed surgeries. It's a slow erosion of the safety net that they spent a lifetime paying into. That's important to remember. We spend our lifetimes paying into Medicare so that we can have that safety net when we retire.